Welcome to Electrolysis Unplugged, an after-hours chat beyond the probe with Joannie and Stephanie. We're here to dive deep into the world of electrolysis, education, and all things hair removal.
Whether you're a seasoned professional or just curious about the art of permanent hair removal, we've got the insights, tips, and fun stories to keep you plugged in.
So grab your tools, take a seat, and let's get into it. This is Electrolysis Unplugged, brought to you by the Electrology Education Coalition. So Joannie and I were kind of coming up with an idea of what to talk about tonight. And really, we have a lot of questions around like skin reaction, like when can we treat in that area, that kind of stuff. And so I think most of our focus is going to be there this evening. And then depending on how long it takes us to get through just that topic, then we can kind of like open it up for some Q&A with the minions here, and then go from there.
Oh, sounds good.
I'm like, I just let Liberty in, but she's all the way out in Toronto. It's late there, yeah?
Yeah, maybe she just joined the membership, I think, this week. So
Yeah. She just finished, I was just talking to her the other day, Liberty, we're talking about you. She just finished schooling up in Canada, and she's in Toronto, which is kind of cool because I had family there for a long time. So
well, welcome, Liberty.
Okay, so in discussion tonight, we're gonna start our conversation about suggestions in regards to numbing cream, and just give a chance to start there and talk about like when to use it and how to use, or how the patients can use it, and just proper removal of it when we're working, kind of thing. But we'll also go over some of the questions about like when can you work in certain types of follicles. So let's start off with that question, Joni. So it says, do you have suggestions for people who use topical numbing creams to help it work better? Um, and let's go start with that part, and then we can kind of.
Okay. I can tell you in all the years that I've been doing it, there's been a lot of clients that bring their own numbing creams, that source things online, that cross the border because we're close to Mexico and go pick up things at, a pharmacy clear nearby, and, get compounded pharmacy stuff, like doctor recommended stuff. Most of the time, the best that I had ever found was just a straight 5% lidocaine when it's put on properly. Even, high percentage of lidocaines and sprays and things that are supposed to be fast acting, all of that. I haven't really seen much of a difference when it comes down to it. What I usually kind of explain to clients is, what we're treating, if this is the skin, what we're treating is down at the bottom in the dermis. And so any kind of topical that I'm putting on top of the skin has to absorb through the skin, and not just numb the top of the skin, but absorb through the skin and numb down at a level that's in the dermis. And so there's only so much of whatever we're putting on top that is going to really numb down at the bottom where we're actually working. Numbing cream works great if you do things that are superficial. So when you do the skin imperfections, right, like skin tags and ruby points and that kind of stuff, that numbs so easily. 10, 15 minutes, you're good to go. But how we have to use numbing cream is a little bit different because what we're trying to numb is so much deeper. And so most of the time, clients, I tell them they have to put it on like icing on a cake. Why? Because if that top layer dries, it's no longer going into the skin. And so they have to put it on thick. And then you don't want it to dry, so you need to put an occlusion on top. So that usually ends up being the cellophane or the saran wrap. And I know that out there, any kind of doctor will say, don't put too much on and don't put saran wrap on top, right? Or like some sort of cellophane on top, because that's how you can end up getting poisoning from it, lidocaine poisoning. So that's another real thing that we need to talk about. But for the most part, how can I get it to work well? It has to be on thick and it has to be occluded. The minute that it dries, you almost start your clock as to the sufficiency window, which is about 15 minutes or so once you wipe it off. So another thing to note is when you're doing a large area, you got to leave the numbing cream on and only uncover where you're really working on. Because if you wipe everything off, then you really kind of have 15, 30 minutes to clear to work through that area before the skin starts to sensitize itself again.
I would go as far as say is so that denaturing of that numbing cream that happens as it dries, it's going to deactivate its,
Mhm,
so, um, yes, if someone is occluding that numbing cream, of course, it's gonna penetrate and, saturate that skin so much better, but you have to then think about how much area that we're gonna be covering during that
mhm,
time. Case in point, today I had a patient who could handle pretty much anything, on her face except her upper lip, and so she used Zensa, um, right before we started working, 5% lidocaine, and what we did was I worked her cheek as a starting point, and then she put numbing cream on half of her lip. It was a 3-hour appointment. So basically, I did an hour here and then 30 minutes up into her lip. Okay. Then we went to the other side. We did not have numbing cream on the other side. We did an hour here, and when I was doing this hour, this side of her lip was numbing. That way, in the 3-hour session, hour, hour, hour. But
mhm.
what I did was I was able to improve that shelf life of that cream on my patient's face, without having to occlude it. We just kind of just did a goopier layer. But you need to make sure that you are, like you're doing all that you can to either keep it moist or, when you go to work on it, you have to wipe it away completely because that is a conductor.
Mhm.
Uh, and so some of the creams out there are like the cream-based ones are very easy to wipe away. Joanie talked about that 5%, and I sell the 5% to my patients, but then we also have the medical side of our practice, which that's a BLT cream that the doctor can, prescribe. The BLT is an ointment based, and that stuff does not come off with lava soap and a SOS pad, and, like, you really have to scrub it some and it's rough. And so, while it works so well because of that oil kind of consistency, I will say that, like, in the interim, you are going to be scrubbing that area, and then you have to worry about kind of, like, how is that skin reacting?
Irritation.
Irritation, because you don't wanna work through compromised tissue. So, I don't wanna sit there and scrub off the cream. What I will do if you're using ointment base is have you go into the restroom with some gentle cleanser and, even just a baby wipe and kinda just help me get that off of there before I can start working.
Sure.
But
Um,
15 minutes is kinda like my window too, like, 15 to 30 minutes for it to be on there,
yeah.
and then 15 to 30 minutes for it to stop working.
See, I
I have
recommend they do at least 45 minutes to an hour before on whichever area we're gonna work on. That is gonna give me about 30 minutes of work.
Yeah.
So, it's whatever it is, it's usually going to be about an hour before. They put it on nice and thick, they occlude it, they come in, and then in that period of time, whatever I uncover is what I can clear in about 30 minutes. And then, we kind of inch our way up if it's a large area.
Yeah.
Or like Stephanie said, the good thing to do is just to sometimes if I have a 2-hour session and not everything needs to be numbed, I will apply the numbing.
Mm.
And then we work somewhere else while that's taking action.
And, double check with your guys' states when you're doing that because some
Hmm.
states were allowed to apply and some states were not allowed to apply. Um,
Sure.
Over the counter, usually it doesn't really matter, but when it becomes prescription, you really have to, like, allow
Oh,
that
that's so
patient.
nice. Mhm.
I have in the past had patients utilize so much of that cream, and, like, I can never get through someone's face like that, and when they come in and they're just covered in Saran
Mhm.
wrap and cream, I sometimes, I've had to put my foot down and just say, like, "I need you to remove this before you walk in my door," because the risk that they did to just get a small amount of hairs removed, is something I don't really wanna have on my table.
Well, increasing the side effect of too much lidocaine is pretty much poisoning, right? Lidocaine poisoning. So there's so much of it entering your system because it is entering your body and it is a toxin. So if you put too much on, the risk is that clients can end up poisoning themselves and they ended up in the hospital with it.
Mhm.
So you want to be careful with large areas. If somebody's coming for a full back, they really shouldn't be covering their whole entire back with the numbing cream. You should be doing small areas, and then as you're clearing that, you can numb something else, but it shouldn't be that the whole entire back is covered. Same with legs. You have to be careful with how much they use and with the occlusion on top of it, just to be on the safer side.
Oh, yeah. I'm Whenever I have a large area, I'm just like, "Hmm." And, like, my rule, just so you guys know, and I've kinda stuck to this, is a 2 by 4-inch box of numbing at any given time in an area. If it's larger than 2 by 4 inches, then I'm not gonna be putting that numbing cream on there, like,
Mhm.
for myself. If somebody covers something larger than that, I'm not even gonna get to it. So I explained to them, like, "I need you to cover it in the timing that I can get to it so that you're not wasting expensive product and taking a high risk in there."
Mhm. And
I
same
have
thing
a
with
client,
faces. Oh, go ahead, Pauline.
I have a client that I'm very concerned about this for him now because he's the same one, the big baby. He since he's been seeing me for 6 months now, he bought a 20 pack of the Super Numb from the website. He just informed me yesterday that he used them all and he decided to buy 50 this next time. And this is in 6 months he's gone through this. And he said, "Yeah, I'm gonna try putting it on more." And he gets up, I see him in the morning at, like, 8 o'clock in the morning. He says he gets up every day at, like, 4, takes a shower, and then starts the process of just globbing this stuff on. And then by the time he gets to me,
Yeah.
he doesn't have it wrapped, so I don't know what he's exactly how far he's numbing.
Mhm.
And then he has me reapply, in areas that as I'm working too. So now I didn't know lidocaine
Y
poisoning was a thing, so now I'm
yeah.
kinda concerned.
And
I would
Pauline, something
well,
he
stop.
has to realize is that there's gonna be, like, a max amount of efficacy that you're gonna get out of these tubes anyway. I
Mhm.
don't know that putting it on and sitting with it for 6 hours is any more beneficial than putting it on an hour before.
Right.
So, like, it doesn't make sense to do this much. And then does he need to glob it on his whole entire back? Are you even getting to all of that?
I don't know. That's why I'm saying I don't know. I don't think he's ever. I think he's because it's a Brazilian, so it's like
Okay.
all the top part, and
Yeah.
then he's probably doing the sec as well. Even though we normally don't get to the whole thing, we're re-clearing, but we don't always like get a re-clear because sometimes his appointments, we have to skip some appointments.
Sure. So
But
yeah, it's a sensitive area. There's only so much efficiency that or efficacy that you're going to get out of the numbing cream when it's 5% lidocaine topical. That area hurts. I don't know that it's making it any easier for him to be doing all of that, except that it's just making it more risky. And maybe
yeah,
it's just concentrate on smaller areas, just so that you can limit kind of how much cream is going to be in that area.
I mean, I don't understand what when I first started seeing him, I
Mhm.
was on, like, Synchro 4, like, he was doing fine. He wasn't, like, numbed because he was, like, a new client, and he's like, "Yeah, I could do this, I could do this." And I don't know what's happened, but over the time, I mean, I'm down to, like, Pico 4, like, EL's around, like, 309, I never really go above, and it's, like, super sensitive, and I try to move it down, like, I'm right at the cap where it's like, it's not working, and then I'm like, "I'm sorry, I have to bump it up just the tiniest bit," but that tiny little bit, it, like, makes all the difference, and now he's, like, basically crying again, and this last appointment, I tried mellow, I tried increasing the time, lowering the intensity, and he's just like I don't know if he's just all up in his head now, he's just like, "Just go back to, like, what it was, I guess," I don't know, and
Yeah.
I don't know, I'm just having a real hard time with him and his pain tolerance lately. So I'm not
I
really sure how it got worse.
It
Well, you
sounds like it's in his
sensitize the
head.
nerves. Go
Yeah.
ahead. Go ahead.
It sounds like he's living in his head. I mean,
Yeah.
honestly. Uh,
Yeah.
but that risk is really high. I mean, you're working on very absorbent skin. And the thing is like the longer you're sitting with that cream on, Johnny's right. Like you are not increasing the efficacy the longer it sits on there. At max, an hour and a half beforehand.
Mhm.
Because the fact is like it's only going to numb you so far, right? And then you have to think about like, so this is absorbing into your body, which is there's blood, your bloodstream that is impacted by this, which is how that lidocaine toxicity happens. So basically the blood supply that's feeding the skin gets overrun with a large amount of a
Mhm.
toxic material. And so in doing so much of that, like I it, I bet you anything he kind of got himself a little bit of relief initially and then was like a little should be is good but a lot should be better. And now it's like He's he's taking really high risks, and, like, thank God it's just numbing cream and you don't have epinephrine in here because I will tell you right now, epinephrine plus lidocaine when it's an injection, you can't even do that on the genitals. It has to be straight lidocaine, so your shelf life of, like, or your time that it works, is exponentially shorter. Epinephrine usually like elongates that time that it works. And so when that happens, on anything that's like a phalange or hanging skin, you can cause desiccation of the tissue. It will you
Mm.